I'm about to get out the car. I'm in Streetsboro. Got me a 9 o'clock appointment at Signature Smile. Signature Smile. I'm have to go cause these are falling out my head. Okay. Yeah. Falling out my head. I'm gonna make a video of this, or document rather, this whole thing. I'm gonna go in here, they gonna take my understanding is, they gonna x-ray my mouth so they see how my teeth is. I'm trying to get some, what the hell they call them, velours or whatever, Venetians, whatever the fuck it is. Whatever, clean that up. Some Venetians, whatever, snatch all this out. We buy everything else, I'm about to buy some teeth. Go in here so they can get a blueprint of how they in here, then see what I think they like either 25,000 or 50,000 price of a car. Whatever the case, that's what we here for. And I'm gonna document it. There. So ready, set, go. And YouTube started for me as somewhere to store my family stuff. You know, I thought it was cool instead of a VCR, right?
Yeah.
Just on YouTube. So when I was like 10 or 12, my mama went to the doctor and came back with no teeth. And she never talked to us, she never said nothing. So what I want to do, since it's my turn, is whatever going on in my mouth, I'm gonna record this, and so my kids can, and they'll take care of their teeth. Now I call myself taking care of them because I brushed them. I guess I could have flossed more, but anyway, it could be hereditary. I don't know. Yeah. But here we go.
All right. So nice. I'm Sarah. I'm one of the assistants here. So I know you're on for today for records. So the records are just a series of photographs that we take. We do scanning of the upper and lower jaw, get your bite and everything. And I believe if you were here already for the new patient exam, they probably already did the CT scan and everything.
I did something.
Okay, so that's just the 3D imaging that they use. Once we do that, the doctors kind of collectively look at the stuff going on, and then they kind of give you an overall treatment plan and what's best for you and what's going on in your mouth. So we can go from there, and then that's when they talk to you about it, and then the whole bundle cost and everything. So yeah. So do you have any questions for me?
Let the games begin.
Yes. Did you have a good holiday?
Yeah, anytime I gotta get in that truck.
Yeah.
Yeah.
I know.
But you know,
you're probably super busy, obviously.
Oh yeah, but I've been here at UPS for 5 years.
Okay.
And what I've come to learn is, I don't know if you already know this, but UPS is the North Pole.
Yeah.
Yeah, so it's just getting, every week it gets busier, and the closer we get, it just, it's crazy.
Yes. Yep. That's a great way to put it.
It's the North Pole. No, that's it. It is literally the North Pole. And everything goes on. Everything goes on.
Yes. Okay. So do you go by Robert then?
Yes.
Okay. So the scanner is intraoral. It's pretty quick. It's like does pixels 3D imaging of that. So it just picks up your mouth instead of taking like impressions. So you can do that.
I was telling my wife, I said, after my first visit, I said, man, that's the most high-tech dentist office I've ever been in. Like, you wouldn't believe all of that. Like, it's the other level.
Okay.
But,
yeah, it helps a lot as far as having the better technology and stuff that we can do what's best for patients and pretty much like instant gratification too, you know, so you get your images right away.
Yeah, instead of having a sitting, waiting.
Yeah. be out by a certain time? I mean, not that it's gonna take a
I'll have to
long
be to work
time,
till
but-
12:30.
Okay, so we shouldn't not take that long, but just because we'll be getting the scans and then the pictures, and then you can talk to doc and everything.
Yeah. I'm in no hurry.
Okay. How many kids do you have?
Anyway,
Pretty.
yeah, everything, but
No,
I guess 1 out of 5.
That's
It's a
great.
great ratio.
Yes. Is it okay if I have you sit back?
That's all I'm gonna say. Assume the position.
Yes. And then, so, if you need a break or anything, you let me know. I'm gonna bring you up and set you back a little bit. And then, I know it's not the thing in there. So, the scanner then, you'll hear music. That's normal. That's just how we know that it's running. So, it's not my phone or anything. But, so we'll start from the top. I'm gonna do the top teeth, and then if you need a break, you let me know. Take a look. I'm gonna go through it again. It's gonna be more detail.
I gotta say this. This is
Yeah.
incredible. You would not believe it. I just thought, this is incredible. Let me zoom this out. That's incredible. Look, I was looking for a spray, some paint, some scraping. This thing is a laser or something. It is absolutely incredible. This is amazing. I can't believe it. I can't believe
Show you
it.
the
I was waiting when you said if you need a break. I'm like, okay, you got a brace.
Oh, yeah, no. It's just pretty much like a picture.
Wow.
And it just picks up everything. Yeah, it's really, really cool.
No, hers you need to swallow.
Oh.
I mean, that's the hardest thing. You just don't want the saliva to build up.
Yeah.
I'm ready.
Cat. I do a little bit more of the palate, but so there's your teeth.
That is crazy, man. That is crazy. 1, 2, 3. Look at that. That is crazy. Wow. Now, all while you were doing this, I said, I'm gonna see my teeth on a level I've never seen them before. Like no one ever see.
Yeah, like
Wow.
that. Yep. So it just scans. So
That's
this
incredible.
is the top part, the palate. When you pull down, this is what you see. You see normally.
Me and my wife would go wine tasting, right?
Yeah.
And they'll say, okay, take this and clear your palate. So I was saying that to her, like, when she want me to taste something, let me clear my palate.
Yep. That's great. All right. So we'll do. I'm gonna do a little bit more of the palate, and then let's see.
So when they replace them, is it the whole? I guess he'll explain that.
Yeah, it depends on everything you need and stuff. So.
That's how your shoe look. That's pretty.
Yeah.
1, 2, 3. Wow. This is crazy, man. This is crazy.
Now we do the lower.
Looking at that, I understand what it's doing. You can relax to a level of it's different than the other dentists because you don't have to. It's no pressure, there's no air blowing, no nothing. It's just
sometimes
taking pictures.
We do air dry a little bit sometimes, but
I mean it's so light. You know how sometimes the air be so cold it kind of hurt, but
twinges and So lower's a little bit different just because of the tongue and the saliva and everything. So not that it's gonna hurt, but it's
in action. I can't wait to see these bottoms because
That's what bugs you?
that's where all the action at.
Yeah.
A lot of action. Before I got out of the car, I moved her to a loose. Yeah.
Yeah. So it's perio involved, so which means a bone loss over time just from gum disease and like you said, hereditary can happen as well. So even if best way to prevent the periods going for, you probably know, like your checkups and cleanings and stuff. Once you have periodontal disease, it doesn't, you can't get rid of it. You can just slow the progression of it. Like coming in, usually every 6 months, and then if you're on a perio maintenance, it's usually like every 3 months. But they don't have to do like a deep cleanings. It just keeps everything healthy as far as what can be, left over. If that makes sense. Yeah. Okay, still? Just finding all the little things like it's yelling at me for. Is that one too painful at all for you? Yeah. Technology is always advancing, and it's way better than
None of it hurt. Just didn't loose.
the loose.
Yeah. But you were saying that, I know that's my experience where once they told me I had it, it's just slowly progressing. And then it made me relate it to life, right? No matter what you do,
it's always
you're going.
Yeah,
right.
yeah. So obviously nothing is as good as what they say God gives you, but go ahead and bring it together and hold it. Yep.
You want to bite it?
Not this.
Okay.
Your teeth. Sorry.
Okay.
So I'm gonna pull your cheek out. Yep, and then bite your normal bite. Is that how you with your back teeth? Yep. Does that feel normal to you? Okay. Yeah. Sorry.
I'm good.
Do another. open again. Thank you. And I'm gonna bite together. Being silly is right. Let's do the other side and see what we get. Go ahead, bite together and pull. Perfect. So that should be it for that. Yeah, I was just fixing the bite there. So next thing we're gonna do is some photos. I'm gonna set you up here. But we use a big camera, so I'm actually gonna have you can probably set your camera there if you want.
Oh, I'm gonna sit over there.
You can actually, yeah, I'm gonna have you sit in this chair. But let me move up.
Let me get a picture.
Yeah, go ahead. And I'll be right back. Just gonna grab the camera.
I don't want to do that. I don't know what that is. Wow. That's crazy.
Yeah, even reduce the vertical more. Yeah.
Well, this is fun. I don't know how much more battery I got, but wait a minute. 1, 2, 3. Dang, it's going really good. I want to get that picture so cool. Closing the program. Oh, that's a camera.
Yeah, it is. It's a bright camera.
Man, look at that
So we got-
camera. You know, I need a new lens. Man,
Yeah.
look at that lens.
This is for focus and like mainly of your mouth and face. Yeah.
That camera it do everything, right? Like this one, right? Video and everything.
Yep.
Wow, that's a nice.
Okay. So, I don't know if you're familiar with cheek retractors, lip retractors. No? Okay. So, I'm going to use this chair so you can sit. you can kind of see what we're
Man, I
doing.
like that. I'm looking at the.
The whole thing.
Yeah, that's man. I need that is with the light around the lip. Oh, that's gotta be great. That's great. I got a picture of that. I need to find out what that is. This is fun, man. I am having fun with this camera. Where my thing at? So I can see what my battery like. Oh yeah, battery pretty good.
Alright.
Battery pretty. Check. Listener.
You're fine.
Check my battery.
These are the photos that we're going to be taking. So I have a couple.
Oh, I see.
Yeah, so it just kind of,
Yeah.
it's fun. So
Yeah.
I don't know if you've ever played that.
See that? If I do that to my mouth.
We do, have you ever played that game? It's called Watch Your Mouth, and basically it's a
No.
fun family game. You
I
put
never
those
played
cheaper
that.
tractor looking tractors in, and you have to like say different things, and they have
With
to
the-
try to guess what you're
No.
saying. It's fun.
So if you do that, it's hard to read your lips. And what's that game called?
Watch Your Mouth. I
Watch Your
believe.
Mouth.
Yeah.
Like to Google that.
Watch them. Okay. So I will warn you, our that ring that's on there, the flash.
Right.
Yes.
Yeah, I got it.
Okay, you got that too.
Yeah. Well, it's right here. Like
Yeah.
I mean, yeah, right. So that stays on or just flash?
It'll flash. Yep. So you'll see like spots and stuff. So
Well, I can close my eyes.
for the one pictures, we'll need them open. But for the other one, when I'm close up in the mouth,
Yeah.
you can shut your eyes. I usually let them know. And we do use a mouth mirror as well. So I'll have it removed once I get all the pictures here. We do a chair, and then we'll lean it back and we put a mirror in so we can get the top and bottom view, which we have here, but they still like the photographs for it. Okay. Alright. So for this one, just gonna be your normal natural smile, and then you're gonna sit straight up for me. Yep, perfect. Get it chin down a little. I got this check. Okay. And then tilt a little that way. Yep.
It wasn't as bad as I thought it would be.
Oh,
I
no.
think that's brighter.
Is it?
Man, it'd be. Because you can control the luminance, like how bright you want it.
Mm-hmm.
And it's all the way up, man. It's,
Yeah. Let me try one more. Let's see. And just smile, yeah. And then chin. And then the next one I'm gonna have you do is like a relaxed, like kind of like you're sitting on the couch and yeah, see. Usually we
Spoke
just
too
tell you to
soon.
say Emma. Emma. Yep. And then however you're yep, on the end part and then yeah. And then just kind of like a natural like breathe and then Emma. And however it just
this is fun because when I'm doing it, when I'm in behind the camera, it's as natural as you could be.
it's hard.
Yeah. And I'm
Emma. Yep. And then chin, head tilt, and then once you get to the M, just like that and stay. Yep.
So I guess that one gives you the natural show off.
Like, yeah, it's just
Yep.
kind of like when you're resting, just to see how your lips fall and everything with your teeth. And then the next one, this one's called the E smile. So it's not like as high. It's kind of seeing how high your lip line is. So it's kind of like E, and then yeah, you can kind of. Yep, that's good. Good. Okay. That was good. So now we're gonna do the profile. So I'm just gonna be, yep, this way.
You don't need any teeth?
Yeah, no, just the same smiles. We're just gonna do them the side.
Okay.
Yep. And then sit straight up again for me, and then your head down a little slight. Yep, perfect. Just your natural smile.
Don't need my mouth open.
Nope, nope, just smile. You could do with teeth if you just do like a natural.
Okay.
Yeah, perfect. I know it's a little awkward sometimes. I had to do all of
You
this.
know how they say, well, think of happy thoughts. I think I'm my wife.
Aw, how long have you been married?
We were just doing this the other night.
Oh yeah,
The 13th one? 13th.
almost. Sorry, put you
I
on the
won't carry
spot
on
there.
with the math.
No, it's okay.
Wow. About 13 years.
Okay, that's wonderful. Chin down a little bit again. Yep, perfect. And then this one's just the Emma, the relax, how you were doing. Yep, perfect. All right, and this one's gonna be that E smile.
She gonna say, you just see that 'cause the camera.
Aw,
She's my friend.
she is. That's how it's supposed to be, you know?
Yeah.
Okay.
Tell everybody. But,
Yeah.
everybody don't get that.
Yeah. Do that E smile for me. The E. Yep. Perfect. Very good, Robin. Perfect. Perfect. Okay. Making it easy. So now I'm gonna do the same ones. You're gonna face me though. It's gonna just be of the mouth.
Same one as zoomed in.
Yes. So this one, you're allowed to close your eyes.
Yeah, I might have to.
Yes.
Like I'm seeing that ring over there.
Yep. It's bright.
So which one? What is this?
So this one's gonna be just your natural smile.
No teeth.
No. You can do teeth. Yeah. Yeah. Perfect. And then this is gonna be the resting one. Just kind of with your lips apart and how you're, yep, just like that. Yeah. Good. Okay. Then this one's gonna be the E smile. And then, yep, just relax. And then, yep, you can close your eyes. Tilt your chin to the, what's your head? Yep, other way. Yep, right. Okay. Perfect. Okay, now is the fun part, another fun part. So this is going to be, we do like the E smile. So I get a couple measurements of the teeth. So we're going to do a little, here. Perfect. So I'm going to kind of touch and then just kind of rest it on your lip there. And then kind of do it a little bit like your left hip. Now it's going to be the canine. And go ahead and turn that way for me.
Turn?
Yep, just
For
like,
profile or
just
just-
kind of like that part of your head. Yep, perfect. And then bite together again. And this is just getting the size of the, so I'm going to kind of push and rest here.
Implant filling material? Implant filling material?
Oh, that's that gingerbread stuff, the pink.
Is it a big tube?
It's on there. Oh, give me one
Go ahead.
second. Sir. So you can do the other side too.
This much.
Yeah. Alright. Come on, see that kind of like a cross bite. And then ease the lip and bite. Yep. Perfect. Okay. Next, we do the retractors. wet piece here. Yep, so go ahead and, go ahead. So they're gonna, I'll show you.
Yeah.
So it's just gonna kind of pull your lip back, just like that.
I got to hold it?
Yeah, so you can hold from way back here if you want. That'll be. Perfect. Okay. And then.
I like the Joker.
Yes. Don't mind me. I'm gonna go ahead and down a little bit, and then I'm gonna move your head just perfect. Okay.
Relax.
Yeah. Okay. So we're gonna look that way for me. So you're gonna not take it out, but just, yep, relax it, and then you're gonna pull back farther here and still bite together your normal. Perfect. Go ahead and bite all the way down in slightly. Okay.
Anything all
Yep,
right?
perfect. Look at you. Bite together.
On a counter first.
Yeah. It's nice because you're cooperating a lot, which is very nice. Okay, perfect. Hold on, I gotta do. So just gonna switch this. I'm gonna do a close up,
What's that?
or not close up, far away. Oh, push it up.
I'm about to say put some makeup on
Oh.
and Halloween.
Go ahead and bite again. And then chin down. Good job. So we're going to be using these again in the chair though. So I got all of those. So if you can't, we'll do a switch. Yep.
Swap it out.
Yeah. Is it stable?
Just want to I can see the if I can see that, I can see my head.
Okay. So I'm going to do now is I'm going to bring it up and then set you back. So the main teeth that are sensitive is lower front ones, right?
Right.
Sorry, this is a little awkward.
I'm just trying to send my
Get-
head to the.
Is it? does
No,
it
it's
feel-
it's cool.
Okay. So I'm gonna give you these again. Gonna do the same thing, and then we shove them here. So this is gonna be right here. So now we're gonna do, and then I'm gonna try to have you breathe through your nose as much as possible. Go ahead and open yours this wide as you can too. And then,
Check them next time, okay? Alright, you're ready to go. See you next time.
so with these ones, is it okay if I have you kind of pull them upward a little? Yep.
What's that?
Perfect.
To be honest, not the finest teeth. With what's happened, we were supposed to be finishing on this time at this point, but we're now into, this is our third time trying the teeth to make sure that they're good. If we got it, of course, I think like if we had today, everything went well, we could have finished it before Christmas. But we need to start, and it's about even the S sound, and that's why we're gonna change a couple of things on it. So let's see if I
We're gonna do the same one, but if you need a break, you can.
And but probably finish after Christmas, right? Alright, see you next time. Next time will be the same as today, okay?
Beautiful. Okay, so now go ahead and bite again. And sit just like that. Camera's way. Sorry, camera. You can take those out. So what I was getting was, from this angle, it kind of shows how your bite is, if it's a deep bite. All right. So that consists of the records appointment. So basically Doc's gonna come in, take a look at everything, and then You guys can. Oh, you gotta do a selfie, but that's with the doctor.
Okay.
I can grab those from you.
That was
Thank you.
fun.
Good. Alright. Painless, right?
Yeah.
It's a little uncomfortable sometimes, but just with the.
I imagine the pain is down the road if there's any pain to be felt.
They're very good though. They'll help you. They'll do pain management and everything with you. So they, you know.
And then you know I got some teeth.
Yes. All right. So I'll be right there. Have him double check these, and if he wants more, we'll just.
All right. She opening up something. Is there something to get? I'm gonna get it, but man, that was wow. Seeing if something opening up on that screen. There, 1, 2, 3. There it is. That's my little raggedy mouth. I don't know what that green is, but how my teeth come over and all that. Looking at different images of what? Let me get a different image. That's different. Okay. Leave that alone. 1, 2, 3. Do this right here. Set it up, wait on the doc to come in and tell me what the hell is going on. What the hell is going on? I should pause this. 30%. Let's see what happened. Wow.
And I think it looks like the CT, right?
I want to see that scan from the. I want to see my bottom teeth. I want to see them from the scan. I want to see them the way I saw the top. I want to see the bottom. 'Cause I know that gum line. Every time I go to the dentist, it would be getting lower and lower and lower. It's like a high at the beach. And the shore be corroding away. And you get closer to the house falling in the water.
Hardly working.
That's how my teeth is, how my gums. And it got so low. Like ain't nothing holding them up. That's why it's so loose. Must be 40 years. Must have started when I was 10 or 12. I can't remember a time where I just didn't brush my teeth, I see something. She just never, as a kid, I never went to a dentist. I don't ever go to a dentist. Doing this to see what it costs to get a whole set. I don't want no dentures. I don't want nothing that come out every night. It's got to be whole, whatever that costs. Whatever I gotta do to pay for that. I'm not accepting nothing else. I'm gonna buy nothing else. Whatever on my credit I gotta pay down to get my score to whatever it's gotta be to qualify for the loan, to get to whatever, we doing all that. We're not, that's it. You know how I do. It's everything or nothing. this thing is terrible too, man. I could try to bite, and I guess I put this hat on. Give it a try.
So Robert, we have an older CT scan, but we need an updated one. So,
Okay.
if you want to come through and grab that.
Well, pause this, I guess.
She's welcome to. So there's your lower.
I want to see the back of it. Wow, that's crazy.
So-
It don't look as bad as I thought it was gonna look. I thought it was gonna look like that last image. I
Yeah.
thought it was gonna just be.
Well, that's because it's hard, but see all this right in here?
Yeah.
So that's like hard tartar.
Tartar, yeah.
That builds up, and then it kind of,
But
yeah.
I guess
Go ahead.
this right here, that gum line's so low. That's why they loose.
Yeah,
Cause
well-
it should be way up here somewhere, right?
Yes, it should be the
About
clinical
right
bone up
there.
here, yeah. And then the bone has pulled away so much
Right.
that that's where you get that from. But I can't pull up the CT. I can do a pan of CT for you if you want me to save it that way, but.
Well, I'm looking forward to a new set so I can be cute.
Yeah, absolutely. Aw. All right, I'll be right back.
All right, thanks.
You're welcome.
Oh, look at that. That is crazy. Let me turn it. Hold it. Roll it. That's how I gotta do it. I don't know how to turn it. How do you turn it? Up here. How do you turn it? I don't know how to turn it. A little raggedy grill. There it is, but it's my little raggedy grill.
Hello.
Oh,
How are you?
all right. Let the games begin.
Alright. So, my name is Omar. I know I'm the first time you met my partner last time, Dr. H. It's been a few months, right?
Yes.
And now we're going back to say we just plan on fixed teeth, top and bottom, take everything out and replace it with the implant, correct?
Right.
Alright. So, what we're gonna do today, what we've done today is we put all of the information and think about like building a house. And when we're building a house, you go to an architect, they put the blueprints, go into the details of it. Can we do it? What exactly we're doing and the minor details of it. Like that's what we're doing right now is we got all the information. Then myself and my surgery team would go in, put the blueprints, and in 10 days I'll sit down with you and we go in the details, what exactly we're doing, how many implants we're putting in there, the bone grafting, if it's needed or not, all of the details of it inside out, and how much it's gonna cost. We know at this point around it's like 26, 27 the top, 26, 27,000 fixed on the bottom, and that's usually 90% of our patient, unless when we sit down there is a major like bone grafting or a major defect or something, and we usually be able to tell you that, okay? And what we do usually is so the next time will be actually more detailed and I can answer more questions than today. And usually once we get you a number, we say this is how much it's gonna cost, we'll never come back and even if it needed more work or something, we're never gonna come back and ask you for more questions.
No, you answered everything that was on my mind.
Okay, good, good.
So,
And next
any
time,
other questions be
Yes.
answered in 10 days.
yes, so in 10 days I'll go into more details of it, and if you have any question, I'll be more than happy to answer them. Sounds good?
Great.
All right. I see you like video. So.
Well, I got YouTube. So how YouTube started for me was in the beginning, just some goofy. I didn't understand it, but I thought, man, what's cool about that? I can record my kids' parties and this and that and store it there. So in 10 years, 20 years, instead of looking for the VHS tape, it's just on YouTube. That's how it started.
Okay.
And over time, it's just been some everything. So the point in this today is, I was telling, what's her name, Renee?
Sarah.
Sarah. Yeah.
That's
But,
right. Pretty close.
So, when I was 10 or 12, I just know my mom went to the doctor, came back with no teeth. And she never sat us down and talked to us and then so I said, since I'm going through this, I wanted to record it and show my kids so that maybe they'll have some, you want to know the family lineage and some kind of, it could happen to you and maybe you take better care of your teeth or something, and that's the point. But yeah.
That is fine. The only thing we're gonna ask is not to share it.
Oh no, this
Okay.
is embarrassing.
No, I mean, just to. It's for you actually. And-
That's what I'm saying.
But
This
it-
is for
yeah,
my
but-
private. Yeah.
Yeah.
It's just for the.
But other than
kids.
that, we should be fine. So that's actually the
The most I'll share is before
and after. Yes, and you'll
Not all
be
the
super
details.
happy after that.
Oh,
It's gonna
I've
be
been looking
nice-
at people.
Yeah.
I know a guy who got some. I asked him. I said, "Man, you got a great." I was using this camera. I said, "Man, you got a great smile." He said, "These are velours. What do they call it? The when you replace the teeth, they velours."
Veneer.
Veneers, yeah.
He said these veneers. I said, "Oh." I didn't tell him. I'm like, "I'm getting some now."
Nice.
Yeah.
Say, and who's your friend who told you about here?
It's a guy. No, nobody told me
No,
about
okay,
here.
okay.
This is a guy that I just
Oh,
know.
I see, okay.
Yeah, and I always thought he had a great smile.
Got it. Okay, got it. No, and what we do here, there's three guarantees we do, or two guarantees we do here for you. This is a nice trip. It's gonna be a nice journey. Okay, it's gonna be in and out. It's a major procedures. It's life transforming. Okay. Go
I did
ahead.
have a question.
Yes.
Once we get going on this, is this all happen in one day or is it several?
We'll talk more about it next time.
Okay.
I'll go through all of that next time.
You
But
can't-
it is the major surgery and the major teeth is coming one day. So you walk in at 7 a.m. or 8 a.m. You leave at 7 p.m. with upper and lower teeth.
Okay, I'm not going to work.
Yeah, you're not going to work for that week.
What about the next day?
We'll talk about it next week.
Okay.
So I'll go more into the
That made more
details.
sense because you just
Yeah.
told me in 10 days you had a whole blueprint.
Yes, and that's why I don't want to say anything today that's said and then there's like, when we did it, because we have to see the quality of your bone and all that. Now, but what we guarantee for you is once we're done, two things is you're gonna be super happy with the teeth. It's not like, all right, get the teeth, get out. Like this is the teeth that you got. No, you're gonna be super happy. You're gonna be part of the process of how we, getting the teeth. So you'll see the final teeth in your mouth before we finish. Okay, that's number one. We guarantee for you. And the second promise is you can eat with them. We don't want them to look nice, not function, right? So we do like a steak challenge. If you go to YouTube and actually put Signature Smile Steak Challenge, you see a lot of our patients going through a steak challenge. Okay, where they actually at the end we send them to a steakhouse. They had to eat a steak, and that's when we can, okay, we're done with you. We want to make sure that you can eat and be happy about it and take it from there.
Look forward to the steak challenge.
All right, perfect.
And so when I leave here, I'm going on YouTube to see the steak challenge.
Yes. All right, so Sarah's, we're gonna do a consult in 10 days, and we take it from there. Okay? It was nice meeting you, buddy.
You too.
Take care.
You need anything else from me?
I do not. I'll walk you out though. Here.
And for the record, y'all, this is Sarah, and
Hello.
Sarah's a lot of fun.
Thank you.
She's just so, I don't know what the word,
Easy going.
easygoing, down to earth.
Thank you.
I guess it's like anything else when somebody know what they're doing.
Yes.
You know, like
Been doing it a long
when they know
time.
what they're doing, it's just a whole lot better.
Makes
But
it
man,
better.
1, 2, 3.
Absolutely.
This is another good before. Look at that. You see all them? All that shit had gum in it. All them. See, this the gum line. Gum line should be way up here. And over the life of my mouth, it's just been deteriorating. That was a wisdom tooth that came out right there. And yeah, that's the grill. That's the grill. I don't even want to show this to my wife. Why? You know, you see something, now you look different. But we gonna fix that. So we'll be back in 10 days. So no steak today. We about to go get an omelet.
One
About to go get an omelet. But yeah, this is cool. So it's 10 days from now. Today is the
Oh, Marcy.
today
I
is
take them for you.
Oh, let's
the 7th, so the 17th is 10 days.
Yeah. What are we doing?
I'm
Documenting.
documenting this for my kids.
Really?
Yeah, because my mom went to the dentist, I think I was 10 or 12, came back with no teeth, and she never sat us down and talked about nothing.
Wow,
So
that's awesome.
as I'm going through this,
Yeah.
I'm doing this just for my kids so they
Yeah.
can see it.
They can
My
see
son 21, my daughter's 26. And maybe, you know, you save your teeth.
That's awesome that you're doing that. I love that. Yeah, I love it.
Upper and lower bundle contact are fixed.
Okay, great.
All right. Well, nice to meet you.
All right, I'll see you when I get back.
Yes, sir.
Yeah, so I have December 21st, which is a Wednesday. I have a 10 a.m. that morning, if that would work for you.
Yeah, that works because I don't go to work till 12:30.
Perfect. Great. And let me get a card for that, too.
December 21st. I'll put that in my calendar. December 21st. It's a Wednesday. Add event.
Here's your card for you, and then you should be all set.
Signature smile. Appointment.
Yeah. Yes. It is Streetsboro
All right.
All right.
Thank you.
Until next
See you then.
time.
Yeah, see you next time.
at
Dun, dun, dun. And that's today's episode of Signature Smile. We just recorded my raggedy mouth. We're in Streetsboro. We gotta be back on Wednesday, December 21st. Out.